Uh, Good morning. We are continuing in our series of public enlightenment on COVID-19. And this is the first time we are coming on this medium, having done several series on the Facebook. So we want to also start another series on this medium. And the topic we are going to discuss this morning and probably also in the evening on Facebook for our viewers who are regular on Facebook is about developing trust in our healthcare system. Uh, what we know is that our patients, even at this time of COVID-19, have stopped coming to the hospital. That is, those patients who do not have COVID-19 illness, they have stopped coming to the hospital unless their condition has become an emergency. We can understand why. They think the hospitals are probably becoming a source of COVID-19 infection as well, and nobody wants to get infection. They rather stick with what they have, with what they have had in the past, like diabetes, hypertension, and even cancer, rather than coming to the hospital and get infected with COVID-19. But we want to encourage the general public, especially in our country, Nigeria, to say that every person is a potential carrier of COVID-19 virus, including the physician and themselves. It is possible that one might have got exposed to it at one time or the other, but because of the strong immunity that one has, that is why one has not had the disease in a very serious way that would necessitate us getting tested and turning positive and so on and so forth. So the best thing is to assume that everybody has the disease, and that is why we say we should wear our mask um, anywhere we go, so that when we talk, when we sneeze, when we cough, we will not spread the disease to other people, just in case we are a carrier of the disease. A carrier of a disease is somebody who has the uh, germs, the bacteria, or the virus in the body system, but is not showing the infection yet, because it may be possible that his body immune system is still trying to actually stop the disease. So that is who a carrier is. So if you're not show on the face, you're not show any symptom that you have the disease. So we are now encouraging our patients who we have been seeing before COVID-19 came to come back to our hospitals to continue their treatment. They should not be afraid, because we have also put in place measures that will prevent them from getting COVID-19 from other patients or from getting COVID-19 from members of staff, because nobody wants to get COVID-19. And I think what this condition has brought to us is that everybody will try and keep the measures that we have requested that people should obey. Wear your mask, keep a distance, wash your hand regularly, use hand sanitizer. It is important that we come. Otherwise, we may end up having more deaths from other diseases than COVID itself if care is not taken. You may have more complications of other diseases than COVID will have caused in the first place. You can imagine somebody who is being treated for high blood pressure and refuses to come to check up in the hospital and suddenly wakes up and they cannot move one limb on one hand. That is what we call stroke. Imagine somebody who has been using drugs to keep the heart strong and does not come for checkup and goes into heart failure and cannot even move some distance. Somebody has been on treatment for renal diseases and then is not coming for checkup to monitor the blood chemistry, and then the patient's kidney shuts down. That will warrant kidney transplantation, which is more expensive than coming to the hospital. So the other diseases I can list, or somebody who has a breast lump, we're not even sure whether it is cancer or not. At least we come, we do some investigation under very protective care that the patient will not get COVID-19 infection, or the doctor will get COVID-19 infection, and we're able to keep everybody's mind at rest. It is better than waiting until when COVID-19 will go before we come back to the hospital. So we are admonishing the public to come to the hospital. The members of staff and the hospital, we are taking precautions not to get ourselves infected. Just like our patients outside have the burden or the fear of getting infected, so also do we also have the fear of getting infected as well. So it is a mutual fear, and when there is mutual fear, we understand that we need to put something in place to make us to resolve those fears. So This is going to be a short broadcast. Some other time, we're going to deal with other issues, and we hope that people will follow our presentation. There are many things we can discuss on health issues, on our society, political issues, economic issues, as come to us. Thank you for watching this first premiere shots on the YouTube. I hope we're able to upload it and you're able to watch it. Thank you very much. Have a nice weekend. Bye-bye. My name is Dr. Adefemi Afolabi, a consultant surgeon at the University College Hospital, Ibadan, and the senior lecturer at the University of Ibadan in surgery. Thank you. Bye-bye.